So let's analyze some of these emerging trends in the global fight against COVID-19, especially in the United Kingdom. We're joined by Dr. Joseph Omofuma, a general practitioner who joins us from Manchester. Thank you for joining us, Doctor. Well, England already has a roadmap out of COVID-19 lockdown, but there's a potential spoiler, which is the Indian variant. Why is this a big concern, even though vaccination seems to be in top gear?
Yeah, hi, Kennedy. Thanks for having me. Yeah, I think the main issue really is the fact that, first of all, it's spreading amongst a population of people where you have low uptake of the COVID vaccine itself. So that's the first thing. The second thing is the fact that the Indian variant seems to be more infectious, more lethal, and it's affecting young people. So all this contributing seems to be a possible clog in the wheel of the progress that we've made so far.
What particular population do you have challenges with vaccine uptake, especially in that area that might make this a very difficult fight for the UK?
Well, basically, it's well known that it's in the Black and ethnic minority. So you're looking at the Afro-Caribbeans, the Asians, and in this particular occasion, it's where you have a large congregation of Asians, Indian and Pakistani brothers. That's where the Indian variant is spreading. So that's the main cause of concern. As you're probably aware, in the UK, the Black and ethnic minority that have also had the most severe symptoms of COVID and the most mortality. So it's a bit of a double whammy, if you like, when you consider it.
Well, now that you speak of that, I see you co-developed a safety assessment system, which is essentially a result of, like you mentioned, disproportional deaths in the minority ethnic groups, especially Africans, which will be our focus. I mean, an average 40-year-old black man with 2 medical conditions is nearing high risk in the UK, according to that particular risk assessment, which you co-developed. So how relevant is that in getting a handle on COVID-19 in the United Kingdom and even here in Nigeria?
Sorry, I didn't quite get that. What was the question?
Well, I was referring to that safety assessment system which you co-developed, which tends to help you get a sense of just how much of a risk you are in if you have COVID-19, if you belong to a certain ethnic group at a certain age with certain medical conditions. And I'm just wondering, how important is that really in getting a handle on COVID-19 there where you have those ethnic minorities and here in Africa where those ethnic minorities are actually majority?
So that's a very good question, Kade. The point is that within the UK, that risk assessment has more or less saved a lot of lives. It's in honor of one of our colleagues, called Sad, who unfortunately died from COVID. I knew him quite well. He was one of my trainers. He unfortunately died from this, assessment or algorithm. Myself and my colleagues got together and we got this together. Now, it's so far it's been adopted across the board, across many hospitals and trusts here in the UK. Now, when it comes to the Nigerian scene, that's a totally different scenario entirely because, as you probably are well aware, the amount of people getting COVID in Nigeria is nowhere near what we're seeing here in the UK, even though you have a very large black population. And there's a number of reasons for this. One of which is the fact that, well, the weather is very different, and so the transmission is going to be less. Also, as you know, in Nigeria, we have a lot of immunity to a lot of illnesses anyway. In addition to that, one of the main things that have been found to be very protective for COVID-19 is vitamin D, which we get from the sun, and we have an abundance of the sun in Nigeria, coupled with the fact that not a lot of Nigerians travel outside of the UK compared to the overall population. So when you combine all the factors have been helping us really.
Well, Dr. Omofuma, Not quite. It's been quite a struggle getting your response to that question. We lost you at the the latter part where you were trying to just round off on that point. But I'm hoping we have you back. So let me sneak this question in, hoping that the connection will work. Well, Nigeria is also keeping an eye on that Indian variant, which is a big challenge across the world. Over 20 countries have reported that variant. Now, the government here in Nigeria recently restricted travel from India, as well as some other testing and quarantine rules. So, I mean, you know what's happening in the UK. I've given you a snapshot of the government's response right here. Do you think that's enough to keep the Indian variant at bay?
Well, the simple answer is no. I don't think it's anywhere near enough. I don't think we're doing enough in Nigeria, unfortunately. I don't want to sound like I'm slagging off Nigeria, but we could do a lot better. I mean, we could do a lot better. There's so many aspects of the vaccine. For example, the vaccination program just hasn't taken off well enough. We have almost 200 million people in Nigeria, and only 1.8 million have been vaccinated. That's less than 1%. So I don't think that's nearly enough. I think whatever the government needs to do, whatever agencies are involved, rather, they need to toughen up those things, because God forbid that the Indian variant should come to Nigeria. It will be a big problem, and we pray that that doesn't happen.
But doctor, what more can you do? Getting vaccinated is not compulsory, and I don't think it should be compulsory. So really, what more can governments do, leaders do to boost this vaccination drive?
Well, I think in terms of government, if you split this up to be there, government needs to do a lot more. They need to spend more money and get more vaccines into the country, period. Also, the most vulnerable people, what we call risk stratification or triage, there needs to be some sort of a triage system where the most vulnerable, the elderly, the people who have chronic illnesses, this is what has been done successfully in many developed countries, including the UK. They need to be prioritized and be given this vaccine first. It shouldn't be a case of whoever has the money or whoever lives in a big city should be getting this vaccine. So those are the kind of things that we're talking about that needs to be done. And if you talk to my colleagues in public health, they will tell you these are things that are known, but we need the government to listen. In terms of the population, we need to get people to still keep trying to maintain social distance, to wear masks when they're in public places, and to control.
Well, we did push the connection, and I'm glad it worked out. But Dr. Joseph Omofuma, general practitioner from the UK, thank you so much for your thoughts. Let's do this again.